Does porn affect your erections? Have you ever felt that your body does not respond the same way during real sexual activity as it does when you are alone? Have you noticed that maintaining an erection with a partner feels more difficult than expected? Have you ever wondered if your habits, especially related to pornography, could be influencing your sexual performance? Do you want to understand what is really happening in your brain and your body? And most importantly, do you want to know how to recover a natural and healthy sexual response? If so, this is something you need to understand clearly, because this is not a question of opinion. This is a question of neurobiology. I'm Dr. César Noval Font, plastic surgeon and medical director of Clínica NEF with clinics in Spain, Miami, and Mexico. We specialize in penile enlargement procedures, including lengthening and girth enhancement, as well as gender affirmation surgery. On our Spanish YouTube channel, we have helped millions of people better understand their bodies through clear, honest, and medically accurate information. This English channel has been created with the same purpose: to help you understand your body, improve your sexual health, and make informed decisions from a strictly medical perspective. Now, to understand how pornography affects erections, we need to begin in the brain. Sexual arousal is not generated in the penis, it is generated in the brain, specifically in areas related to reward, motivation, and desire. One of the key neurotransmitters involved in this process is dopamine. Dopamine is responsible for creating a sense of anticipation, motivation, and reward. When you are exposed to sexual stimuli, dopamine levels increase, reinforcing the behavior and encouraging repetition. This is a natural mechanism. However, pornography introduces a level of stimulation that is not comparable to real life experiences. It provides constant novelty, constant variation, and an intensity of visual stimulation that the brain is not naturally designed to process continuously. Every new image, every new scene, every new stimulus creates another spike in dopamine. Over time, this can lead to what we call desensitization. The brain adapts, it becomes less responsive to the same level of stimulation. This means that what previously produced a strong response now produces a weaker one. And this is where the problem begins. Because real life sexual interaction is fundamentally different. It is slower, it is more subtle, it involves emotional connection, physical presence, and gradual arousal. If the brain has become conditioned to high intensity, high variability stimulation, real life experiences may not produce the same level of response. This can manifest in different ways: reduced arousal, difficulty maintaining an erection, delayed response, or even lack of interest. Another important aspect is attention. When consuming pornography, attention is highly focused on visual stimuli. In real life situations, attention is distributed. There are emotions, sensations, thoughts, and interactions. If the brain is used to a very specific pattern of stimulation, it may struggle to adapt. Now, let's talk about control. Many men believe that erectile function is purely physical, but in reality, it is highly dependent on the interaction between the brain and the body. If the brain is not sufficiently stimulated in the right way, the body will not respond optimally. And if the brain has been conditioned to respond to artificial stimuli, it may not respond the same way to natural ones. This does not mean that pornography always causes problems, but it means that in certain cases, especially when consumption is frequent and intense, it can influence how the brain responds. Now, there is another important factor: expectations. Pornography often creates unrealistic expectations about performance, duration, and behavior. This can generate pressure. And as we have discussed in previous videos, pressure activates the sympathetic nervous system, which directly interferes with erection. So the effect is not only neurological, it is also psychological. Now, what can you do if you feel that this is affecting you? The first step is awareness. Understanding that your brain adapts to stimulation is essential. The second step is reducing overstimulation, allowing your brain to return to a more natural baseline. The third step is reconnecting with real sensations, focusing on physical experience rather than visual intensity. And the fourth step is reducing performance pressure, because recovery is not only about reducing one factor, but about improving the overall system. Now, it is important to understand that this is not about eliminating sexuality, it is about restoring balance. Your brain is adaptable, and with the right conditions, it can recover sensitivity and responsiveness. But this requires time, consistency, and understanding.
And that is the key message. If you found this explanation useful, subscribe to the channel. Here, we approach male sexual health from a medical and professional perspective, helping you understand your body and improve your quality of life without myths, without misinformation, and without unnecessary pressure.